Hey guys, Lauren here with Bizrok. In this week's video, I want to talk about the process and maybe even the conversation that we should be having whenever we're greeting a new patient. Now, if you've ever done training with us, I'm sure you're like, Lauren, I know how to greet a new patient. That's so simple. I get it. I know. I'm supposed to be friendly and exceptional and greet them with a smile. Yes, all of those things are important, but guys, I want to talk about taking it a step further and truly just making that greeting above and beyond, and you know my favorite word, exceptional. So let's talk about that, shall we? So if you see a new patient is coming in on the schedule, you want to make sure that you are absolutely ready to go and you are ready to greet them, first of all. Now, hopefully your office has enough team members so that the front is never left open. If not, we maybe need to talk about some logistics in the office, but every single patient, whether they're a new patient or a recall, they should be greeted by somebody in the office. They should be greeted by a warm and friendly face. So every patient that comes in, if you've done training with us in the past, you know how important standing to greet your patients is. So that's not what today's video is about, but your new patients and your recall patients, they should always be greeted by somebody standing to greet them. So let's start there. So let's assume that you're following the process and you're standing to greet every patient. When that new patient comes in, you want to give them that extra welcome. Maybe you have the new patient gift ready to go and you're greeting them with the new patient gift. So let's talk through that, shall we? So Susie, new patient comes in and you stand to greet them and you say, hi, good morning or good afternoon, depending on the time of day. Hi, good morning, welcome into our practice. And if you don't recognize their name, guys, it is okay. Sometimes we get so in our head about, well, is it rude for me to ask somebody their name? Is it rude to say I don't know them? Well, we can finesse the language a little bit. So one thing that you might say is, hi, good morning, welcome into our practice. I'd love to go ahead and get you checked in for the day. May I ask for your first name? And when they say Susie, guys, you're really smart. I know you are. You can look at the schedule. Hopefully there's only one Susie scheduled for this morning at 9 o'clock. So say, oh, Susie, you're a new patient in our office. Welcome in. We're so excited to have you today. Guys, you want to greet them with a red carpet Grammy Award-winning rollout. We've talked about the Ritz-Carlton in the past and really just the power of making people feel special. You can do that in the dental office. So make them feel so warm and welcome. It's not a secret in the dental office that most of our patients don't enjoy coming to see us. They may like us, but a lot of patients struggle with anxiety or fears or just the unknown. Our job is to make them feel like they are the most important patient of the day. And it starts with that new patient greeting. So if you're greeting them with a new gift, make sure that you have the gifts on the desk so that they're accessible, or maybe it's under the desk and you're standing to greet them. So hi, Susie, or hi, good morning, welcome in. And the patient says, hi, my name's Susie. I'm here for my first visit with you guys. Susie, we're so happy to have you. Thank you so much for choosing our office. We do have a couple goodies for you throughout the day, but let me go ahead and greet you with your very first gift from us. Guys, greet them with that new patient gift. They are going to feel like a total rock star, a total celebrity in your office. So you just grab the gift and you hand it and you present it to them. And if they're like, wow, I've never been greeted by a new patient gift, that's really special. Again, just acknowledge it and just say, well, it is our way of thanking you for choosing us to be your new dental office. We truly are excited to serve you today. Then you want to transition to, I know you're probably thinking, okay, Lauren, when does paperwork come in? That's where we transition into paperwork, okay? So if your patient, maybe they filled out some of their new patient information ahead of time. Those are our unicorn patients. We love them. There are overachiever patients. So just highlight all of that information. So Susie, I see that you already took care of all of your new patient information. Thank you so much for doing that. I'll just double check a couple quick things while I have you. So you work for ABC Company and you have ABC Dental Insurance. Is that correct? Great. You want to make sure that you have that verbal confirmation from that patient, all right? Maybe you have a patient who they're brand new and they didn't fill out any of their packet. Guys, that's totally fine too. Give your patients grace. Just get them taken care of, okay? So, Susie, I don't see that you already completed your new patient packet. Did you already do that? Am I missing it? Or do you need to go ahead and fill out those forms for me? And when they say, oh no, I meant to do it, I forgot to do it, guys, don't beat them up. Just say, that's okay. Like, we'll get you taken care of and we'll get everything updated for you. Hopefully you are a high-tech office and you've got iPads, because that'll save you so much time and make the process very simple. And so you can present them with the iPad, or you can present them with the new patient packet. Remember, it's always a packet, not paperwork, because paperwork sounds like homework. So it's just a small tweak in our verbiage. So if it's the new patient packet and you have it in let's say a paper format, maybe highlight the most important information that you need before they're allowed to be taken back on the clinical side. So that may be your insurance information, address, employer, where they work, and obviously the most important thing that they need to be filling out is their medical consents and medical history, as well as their HIPAA forms. So make sure that you have that highlighted as something that's very important. Now, let's transfer over to the iPad. So I've been in so many offices, guys, and I know that you are the expert on the iPad and the expert with all of the different forms that they need to be filling out. But sometimes, because we know it very easily, we fly through that paperwork on the iPad and we start toggling back and forth between different screens. And guys, if the patient is new to technology, you've got to slow down. Read your patient, walk them through guide by guide. And throughout the conversation, maybe there's 8 different things. And I say 8 because I've been in a lot of offices where there's like 8 different forms on one iPad and the patient has to go back and forth and back and forth. Pause throughout it. Say, well, step 1 is you're going to fill this section out, and then once you have that section completed, you'll mark complete, and then you will go back and go to the second form. Are you with me so far? So get that confirmation from your patient before you go on to a next step. You want to truly hold their hand throughout this process. Now, I want to make a quick disclosure, shall we? So with our elderly patients, guys, give grace. If you have an elderly patient, I want you to treat them like they are either your grandparent or your great-grandparent. If you were filling out your grandparents' paperwork and maybe you were at a medical appointment with them, what would you want to do? Walk them through the process. You might even sit by them and take care of them and walk through every single question with them. I know you all are very busy and you might not be able to do that for every patient, but try to read your patients. If you see that somebody's really struggling and maybe they can't process everything you're telling them, and maybe they're a little bit older, maybe they're in their late 80s or 90s, guys, treat them like that grandparent. Say, you know what, why don't I sit out there and we can fill this out together? Would that be helpful for you? And when they're like, oh, thank you so much, go out into the welcome area, maybe notify a team member that you're going to be helping that brand new patient, but go out to the welcome area and walk them through their new patient packet, okay? Treat them with kindness. Treat them as if they are your family member, and treat them how you would want somebody to take care of your own grandparent, okay? So if you have any questions, please reach out to us. But so far we've talked about standing to greet all of our patients, but especially new ones too. So standing to greet, welcoming them, maybe even saying, let me be the first to welcome you, presenting them with that new patient packet if they've done, the new patient gift, and if they've done their new patient packet ahead of time, acknowledge that. If they haven't, then guide them through it step by step. And then here's the most important part before you release them to sit back down. So whether that patient's coming up to the front and handing you their completed packet, or they did it online, and so you can just tell them what the next step is, build authority for the clinician that is going to take care of them. Let them know who they're going to see. Even if you're like, Lauren, we already did that on the phone whenever they scheduled. Chances are they probably forgot who they're seeing that day. So build that connection, build that authority. You might even say, all right, Mrs. Jones, it looks like you are all set. So I have you scheduled to see Kim, our lead hygienist. You are absolutely going to love Kim. She's got about an hour and a half scheduled with you today. So she's going to take her time and she's going to go through a lot of different things for you, but you are going to love Kim. She's been in our practice for over 10 years, and I know you're going to have an amazing experience. Is there anything you need before Kim comes up front? and just pause and let that patient take that in. Make them feel so special. You want to make them feel, oh gosh, I get to see Kim today. I get to see the hygienist Kim today, the lead hygienist, and she's an expert. She's been here for over 10 years. Find that connection, help Kim the hygienist out and build that authority and already start to build that rapport between her and her patient. So guys, as always, practice these things. I know not everybody likes role play, but role play is the opportunity to become exceptional at something. Mess up a few times with your team members. That's okay. It creates confidence. So you want to do that multiple times. And then when that first patient comes in, start practicing some of these things. Pick up, all right, just the standing, just stand to greet a patient. I'm just going to focus on that. Once you master that, then focus on, all right, I'm going to change up my verbiage for how I welcome them. I'm going to make sure every new patient hears, let me be the first to welcome you. Thank you for choosing our office. And so you want to start slowly adding these and layering to create that exceptional experience for your patients. As always, guys, please reach out to us if you need anything. Otherwise, we can't wait to see you and serve you soon.